And I've been with the Oakland County Health Division for going on about 15 years now, but prior to that, I was actually talking with Dr. Nasser this morning, and I was at University of Michigan. Sorry, Emily.
No, she should apologize.
Right, other way around. And
Yes.
and when I was doing my graduate studies, I worked in a laboratory for a gentleman by the name of Dr. Lupuma, who was lab director. And what we did there is we cultured and we examined genetically a lot of the kinds of bacteria that infect people with cystic fibrosis, Burkholderia, Pseudomonas, and things like that, and we study their genetic relationships. And, we end up actually both knowing him. And so then I was studying as an epidemiologist, and then I went to the Oakland County Health Division. And for those of you who don't know, the best way I can explain what an epidemiologist is, this is true story. I was potentially being selected for jury duty in an open murder case. And they say, what do? Who are you? Trying to see if you're biased in any way. And I say, I'm an epidemiologist. Defense attorney says, oh, that's interesting. What's that? And I always struggle to explain exactly what an epidemiologist is. And I say, well, I keep track of a lot of diseases that go around in the community and things like that. And he says, oh, well, that's fascinating. Is there anything I need to worry about? And I'm like, well, there's always lots of chlamydia, gonorrhea, and syphilis going around. Everybody in the courtroom erupts in laughter except for the defendant on trial. So he didn't find that one too funny. But I ended up getting selected anyway. So I went on to Oakland County Health Division. I was epidemiologist there for a while, and now I've had the opportunity to be an administrator of our public health nursing services, one of which is our children's special health care services. So I'm going to try to share with you some of the things that might be specific for CF patients, and then we can take it from there. How many, as just kind of a quick show of hands, how many people either have family members that have been part of CSHCS, have interacted with the CSHCS program? Anybody want to do the presentation? No? Okay, good. So you guys have some familiarity with it. So you guys might know a lot of this, or maybe you'll learn, pick up a couple of things, and for those who don't, I hope it's helpful information. So as we were saying, it's been around for a while, and it serves mostly children birth to age 21 for any number of diagnoses, about 2,600 to 3,000 diagnoses. And there's a few diagnoses that you're eligible through life. Hemophilia being one, and cystic fibrosis being another, and there aren't many like that. And it pays for lots of different things, and we'll go into that. Now, with like any other federal programs, there are eligibility criteria. And I'm not going to go through all these, and if there's any kind of a listserv, I can make this available. And that's the thing, make this available, and a lot of this information is online, but I'm just going to put this out there in front of you. Got to be a resident of Michigan, citizen or U.S. documented non-citizen, refugees, things like that. To be part of the CSHCS program, it matters on what your diagnosis is, on what you've been diagnosed with, not your ability to pay. So if you have private insurance, CSHCS can be a good adjunct. If you're on Medicaid, you can be on CSHCS. That doesn't make the difference. What matters with the financial and income is there is a fee associated with CSHCS. However, that can be waived. It varies depending upon your income, your family size. And one thing I didn't know that until recently, until I was getting ready for this, if you're a child, 0 to 18, the income is based upon your family's income. Once you turn 18, even if you're living with your parents, even if you're selling your parents' insurance, it's based upon your income. And so the fee might change. And I say CSHCS is really an adjunct kind of service because it doesn't cover a lot of the basic care. It is meant to provide that support for those diagnoses that need specialty type services. So you'll see a lot of things that it doesn't cover, but that's the point of the program. Now, the application process, and again, we'll send this out to you, so I'm not going to read to you the addresses and stuff like that, but what we really need to get the ball rolling is either a report from the doctor or a report from you, and then we need to coordinate from the diagnosing physician because we need a specialist report, we need some request forms to get those put in, and those application packets, and we can help you with that, are sent to the state. The income review payment agreement that determines your, the fee associated with it. And we're not talking thousands upon thousands of dollars of fee. I asked for a couple of examples. For example, a family of 2 with an income of like $50,000, family of 4 with an income of about $50,000. And it's going to vary, but it's a few $100s. And I know for lots of people, a few $100s, that can be a lot. But depending upon just what CSHCS is going to cover, that could be a really good investment to help cover that. And so this, you see all the different people that has their hands on it. So you're thinking, my goodness, what's the point if I apply for CSHCS? I'm not going to hear back for another year to see if I'm covered. The whole application process for most kinds of conditions, including CFs, can take just about a week or 2. Maybe longer if we're tracking down a report or a form or something like that. But I don't want anybody to walk away thinking, oh, it's a federal program, it's the government, it's going to take, forever and a day. It does move pretty smoothly, at least in Michigan. So why join CSHCS? Well, if you have a qualifying diagnosis and you have private insurance, there's a lot of things that can still be covered that maybe the private insurance doesn't cover for that kind of specialty diagnosis. And if that's the case, you're going to want to look into CSHCS. Everything from medical equipment and supplies, prescriptions, labs, x-rays, the office visit cost, even hospital stays and travel associated costs. We have some clients with some conditions that the closest specialist is in Ohio, and I forget the name of the city, but I pass, it's a very beautiful hospital on 75 whenever I'm going southbound there on the west side. They had to travel to Ohio for this, and that was the closest place to get it. CSHCS covered those travel associated costs with that. Now those travel associated costs, they need to be pre-approved and of course things like that, but those options available to exist. And I know we'll talk about a lot of the policies and things like that kind of later on, but the one thing I want to keep in mind for everybody here, that a lot of people struggle with transportation. And you can imagine struggling with transportation and having to try to get to specialty appointments even if it's just within Metro Detroit area. And so, although yes, transportation costs are covered, for some, just because it's covered, those logistics of the transportation, whether it's working with Logisticare or whether it's working just with our bus mass transit system, is going to be challenging. Even if it's paid for, you still need a system that needs to get somebody from point A to point B. And so when I speak with my supervisors, what's one of the biggest difficulties for our CSHCS clients is transportation. Even if they have their own car, maybe they only have one car for their family, that person needs it to get to work. So that's something that I know my people struggle with every day, helping out patients on CSHCS program. Other benefits, even if you don't yet know if you have a diagnosis covered by it, a lot of those diagnostic evaluations might be covered by the CSHCS program. So for CF, maybe, the sweat test, some genetic screening, things like that. And it's one of those things where if I didn't work in this, as I do, I wouldn't have known that. I wouldn't have known things like this out there exist. And so that's one thing I kind of really want to commend about you guys being here and having these conversations, is that just networks can be so powerful. And, we have the internet, we have Facebook, we have social media, but how often do we still learn just by talking to somebody and you say, oh, I didn't know that, or I have this problem, oh, you should check this out. And then you go and you get more information out of the internet or something. That kind of thing is so powerful. And so if nothing else, just take away some of these bits and parts about CSHCS. And if you're talking with somebody, maybe they're duly diagnosed, maybe they're up in Flint, they would have to call Genesee County to speak with it. But put that out there, say, oh, hey, this kind of thing, they can really help. Have a conversation with them. Spoke a little bit about transportation assistance, things like mileage, lodging, parking costs. Again, even if it's out of state, those kind of things can be covered by the CSHCS program, and that's one of the benefits. Billing issue assistance. Even with private insurance and CSHCS, we have at Oakland County Health Division, we have 5 full-time public health nurses assigned to the CSHCS program, plus support staff, office assistants, other part-time nurses to help out with that, and a lot of what they do with it. And again, I have 3 boys, 4, 6, and 8, with no kind of chronic conditions, and when I have to deal with particular billing issues, it can be challenging for me. And so try, some of you don't have to try to imagine, but you deal with every day working with the chronic conditions, and then on top of it, having to try and figure out the complexities of the healthcare system. One of the things that CSHCS has is a lot of support for that. And if you're on like a Medicaid health plan, most Medicaid health plans have somebody specifically designated as a CSHCS support person. Not just our public health nurses at Oakland County Health Division, but they should, or they're supposed to, have somebody designated as a CSHCS person within a Medicaid health plan to help those kind of people who have those, who's on CSHCS, navigate the system. Coordination of services through Medicaid health plan, including medical care and treatment. The insurance premium payment program. This is kind of an interesting one that I didn't really know about. Let's say you have, private insurance. Maybe you have a really high copay, and you're on CSHCS. If it's cheaper for the CSHCS program to just pay down that copay, depending upon what the treatment is, the CSHCS program, instead of like providing that and paying for that care and treatment, they'll pay down that copay of the private insurance. So then whatever is covered by that private insurance, the private insurance will pay for the treatment, and it really comes down to, is it a net benefit for the CSHCS program to do that? But that's a possibility, and I apologize for having to really kind of talk in generalities, but there's any number of variables from the individual diagnoses, co-diagnoses, what kind of private insurance and coverage and that kind of thing. It does take a one-on-one conversation with a lot of CSHCS support staff to figure out, depending upon the situation, what's covered and what's not. But that support is there. Also, the Children's Special Needs Fund. And this is a fund that is privately funded through donations. And it's there to support children in Michigan with these kind of special healthcare needs when help isn't available in any other way. Now, you have to be medically eligible for CSHCS to qualify for these kind of funds. And they have, and they have a website that I can provide for you. But they have their own kind of guidelines and their own kind of board that kind of, guides them with that. But you don't have to actually be enrolled in CSHCS to be eligible for some of these kinds of funds available to you. You just need to be eligible for the CSHCS program. So even if for financial reasons you've decided not to be part of the CSHCS program, you could still qualify for this. And that's a wonderful support out there. And one of the other nice things about the CSHCS program is essentially peer support. Here, it looks like a lot of people have a lot of wonderful peer support. Now, maybe that's the case elsewhere for some people with CF, and maybe not. But there's a couple organizations coordinating with the MDHHS to make the CSHCS program better and coordinate with people and help them navigate CSHCS and some of the other healthcare systems. And so, again, that's just another option available out there for people when you're enrolling in this program. A little bit about, I can only speak about Oakland County Health Division. Other counties are going to vary as far as how the CSHCS program is administered. But here at Oakland County Health Division, the CSHCS program is embedded actually within the health division. And so, like in the same building, we have our WIC program, Women, Infants, and Children. My Child, Healthy Kids. We also do some screening for Early On, which is essentially a Department of Education developmental screening program. And so we have a lot of those systems intertwined and ingrained directly within our health division, and in particular our CSHCS program within Oakland County. Our public health nurses, they're great. They help out with plans of care, care coordination. They do a lot of the paperwork. They will help down do a lot of the care coordination with you, with your providers, with those specialists to help you really navigate the system. And the one thing that, one of my supervisor for the program, and I'll click to the next slide, Frankie Bonner there, she said, we need like the healthcare systems to notify us when people are diagnosed with these conditions, and then we'll try and contact them and let them know what CSHCS program is all about. And she said, if there's anything that people here who've had experience can provide for feedback, we might not be the ones that's implementing the change or having the direct authority to implement change, but we certainly have input in the process. And so she says, I'd love to hear thoughts, concerns, individual experiences that people have had, good or bad,